to do that. That's the oral spore-based probiotic supplementation, was associated with reduction of incidence in postprandial endotoxemia, a dietary endotoxin. But we also saw changes in triglycerides and a number of disease markers, because triglycerides came down when we resolved leaky gut, inflammation came down when we resolved leaky gut, and the disease markers are things like interleukin-1, interleukin-6, TNF-alpha, interferon-gamma. These are all very well-known inflammatory cytokines that are associated with disease pathology and disease risk. So they were very excited to be able to publish this. And that was a landmark moment for us. So that was our first study. In our view, if we were able to help the system with leaky gut, then lots of other things were possible as well, right? So we had to prove that out first. And just as a reference, we are currently going and doing a 90-day version of the study. This leaky gut study was a 30-day study, and that was a risk, right? Because can you really resolve leaky gut or help it significantly in 30-day period, especially without doing anything else, right? Because leaky gut is multifactorial. It's driven by a number of things. And in this case, we were not doing anything else. We weren't doing any dietary changes, lifestyle changes. They weren't taking any other supplements or support. These were college students. They weren't doing anything good for themselves in that period, in that 30-day period. All they were doing was taking the probiotics. So that was a big risk. But we calculated the risk because we said, okay, to really hedge our bets that the study works, we really should be doing other things. We should be helping manage their diet to a certain degree so they're not eating the worst things for themselves that month. We should, maybe get them some things like glutamine and this and then colostrum and other things. But the problem with doing that is that you might hedge your bets that your data is good, but then you don't know what of those components are working the most, right? Or is it all of them? Do you need all of them at once? Or is it one of the components that's driving it and the other ones aren't really helping? It causes too many questions, and it doesn't really prove the effect of the probiotic. So we took the risk and said, you know what, screw it, let's go for it. Let's just do the probiotic. And then